Hey, it's Dr. Toby here. In this video, I want to show you 3 of the best exercises that help you relieve and fix shoulder pain that came because of lifting. Maybe you were lifting a heavy patient or doing some kind of work-related task, and this is especially helpful for nurses who do a lot of manual labor and can have shoulder injuries, which are really common. I'm going to show you 3 of the best exercises that can help you as shoulder treatments for your shoulder right from home so that you can be able to recover and even avoid surgery. So let's jump right into it. So the first exercise that we want to target is our biceps. And so there are a couple things that you can do, whether it comes to using weights or other kind of apparatus like these resistance bands. You can find links to some of these equipments in the description. But one of the things you want to do is target the bicep, because the bicep is one of the primary muscles that's going to help you to lift overhead and also protect your shoulder. It's an essential muscle that not only bends the elbow, but it also helps you to raise your arm overhead. So we can do a bicep curl. We want to get the bicep nice and strong. And there are different levels of resistance that we can use in terms of resistance bands, or using things like a weight can be very helpful to build that strength. Why this is one of the most effective exercises for helping the shoulder is because one of the things we want to do is get blood flow all the way from the muscle that connects to our elbow and to the shoulder. So the bicep attaches to the elbow and the shoulder. So we want to be able to warm that muscle up and get blood flow, because the healing nutrients are in the blood. And when we increase the circulation, that's going to help to heal any kind of tears or issues that have been going on with the shoulder. Now, why it's also a great exercise to do is because if you have a really severe shoulder pain, maybe you were lifting someone or doing something, whatever the case might have been, and the shoulder is really painful to move, you can get some indirect healing and movement and strength to the shoulder by working out the bicep with an appropriate level of resistance or weight. So that's a very important one. The next exercise that we want to think about is what's called a no money exercise. So one of the things that we can do is to strengthen our rotator cuffs. We can get into a position where we have our elbows locked into our arms, and we want to move our arms out. Now, if this causes a lot of severe pain, one of the things we want to keep in mind is that we want to really focus on our shoulder stabilizer. So our scapula muscles, pulling those shoulder blades together, making sure our shoulders don't hike up, keeping them down and opening them up. And what we can do is use a resistance band as we progress and find ourselves able to tolerate more. We can do the exercise just like so. So these are a couple of ways that we can perform this exercise, moving those shoulder blades together and building strength for our rotator cuff muscles, which are really important for lifting our arms overhead, stabilizing our shoulder. And one of the last exercises I want to show you, which is a great exercise to do, we can do a simple shoulder raise. So what we're going to do here, we'll take this band, we can use a different color. So we'll do this resistance band. We can do the same thing with weight. What we're going to do is take this band and raise our shoulders up. Now, again, if you already are having an injury, you're going to have to modify how far you raise your shoulder up or down. You don't want to push into pain. More pain does not mean more progress. So whenever you're trying to relieve an injury, you want to be able to do pain-free exercises that may be challenging, but they don't cause or recreate the same kind of pain you felt before. You can also use a weight. You can do the same exact thing. Bring that weight up to about shoulder height and back down, and engage in several repetitions of this. If that's too hard for you, you can decrease the weight. You can also decrease the amount of range. You don't have to go so far up, but to regain that strength in a very comfortable fashion. So one of the best ways to get the fastest route to fixing your shoulder is getting an assessment, talking to a specialist, a physical therapist, and you can click the link in our description to talk to a PT first so that you can get a clear, precise exercise plan and regimen to heal your shoulder, avoid surgery, and even to understand what's necessary for you to be able to recover, because sometimes we're doing things in our day-to-day life that's actually helping our shoulder or making our shoulder worse and undermining all the things that we're trying to do to make it better, whether we're using, Tiger Balm or ointments, or using stretching and other kind of things. Some of the things that we might be doing may be counterproductive and sending us back into a cycle of pain and not allowing the injury to fully heal. So talking to a PT first can be very helpful. Click the link in the description if you would like to get a free conversation, talk to one of our staff and our team members who can give you some specific guidance for your situation. If you found this video helpful, like it, make sure you hit the subscribe button, and I can't wait to see you in the next video.